Well, hello, everyone. Obviously, this is a serious time for all Canadians as we see cases rise across the country. It really is a Team Canada effort that has to continue. You know, we know that all Canadians are working really, really hard to contain the virus. Provinces and territories are working side by side with the federal government. And there is light at the end of the tunnel, but we've still got a long way to go. So I encourage everyone to continue to follow the public health measures that are keeping us safe, to reducing their gatherings, to making sure that they're staying home when they're sick and washing their hands and wearing a face mask. These are the things that we know can protect us from contracting the virus and from infecting our family members, which is so critically important over the next several months.
We'll now go to the question periods. On va maintenant passer à la période de questions. One question, one follow-up. Une question suivie. Avons-nous une question au téléphone? Opérateur.
Oui, merci. Catherine Lévesque, à vous la parole. La presse canadienne, please go ahead.
Hi, Minister. I wanted to ask you first off about Annemie Paul's comments this morning. She said there are too many codes across the country. It's a lot of mixed messaging, and she suggested that we should have in Canada national standards across the country to try to balance it out and make it easier for people to understand what they should be doing. I was wondering if you could comment on that.
Well, absolutely. Look, all along the way, we've given Canadians clear and consistent advice, and it evolves along with the science that evolves as we understand more about COVID-19. I will say this, the provinces and territories, of course, have different circumstances and different outbreaks that they're managing. The best advice for Canadians is to understand the principles around how to reduce spread in general, and of course, follow any local public health measures, because coronavirus is more significantly spreading in some parts of the country than others, and Canadians need to know what restrictions apply in their own jurisdictions.
So my follow-up is, what should a person do if, let's say, you know, there are, if it's not coherent, or if there's some mixed messaging between, let's say, what a province says and what a city says? How, like, which local authority should we listen to?
I think it's very important to listen, first of all, to local public health authorities. Local public health authorities are closest to the ground. They know the number of cases that they're seeing in their own particular areas. I work at all levels myself as a Minister of Health. On the weekend, I was having calls with local public health officers, with the provincial health ministers, to make sure that I understood what their needs were and what their circumstances are. I'll be very clear again, there are some overarching messages that Canadians can use to protect ourselves during the next several months, which are going to be difficult. And I will say that will help us get to the light at the end of the tunnel that we all see. They are things like making sure that we stay physically distanced from one another, that we reduce the number of gatherings and social events that we're attending, you know, that we resist the urge to host our friends in our homes, even though we're all looking for ways to gather and to connect during this difficult time, that we stay home when we're sick, that we wash our hands, that we wear our face masks. These are all messages that Canadians can follow, no matter what their own specific measures are within their own jurisdictions. And provinces and territories, and indeed local municipal public health officers, are applying additional public health measures that will assist depending on the outbreak situation in that region.
We will now take one question from the room. Hello,
Mr. Hajdu. My name is Malhamidi. I'm with the Canadian Press. I want to ask you about the Moderna vaccine, the results that were announced this morning. What this news would mean to Canadians who are waiting to be vaccinated?
Well, thank you for the question, and that's exactly the light at the end of the tunnel that I'm speaking about. The fact that we now have two promising vaccines, and both that Canada has options to purchase, as you know, is good news, but it is also early news. There are a number of steps that have to be completed with any vaccine to make sure that it is, in fact, safe for Canadians, and that's the work that's happening now. We also are working, as you know, with provinces and territories to make sure we can distribute these vaccines across the country, and it is, again, a Team Canada approach. The provinces and territories are working out their distribution plans. The federal government is working out our distribution plans. But the upshot of this is good news. And the fact that both promising vaccines now are both vaccines that the Vaccine Task Force here has guided us to purchase, I think is also very good news for Canadians. And I want to thank the Vaccine Task Force for their expertise, because they have indeed led us down a path where we have options on two now very promising vaccines.
We'll now go back to the phone. Opératrice, avez-vous une autre question?
Appuyez sur étoile 1. Please press star 1 for questions or comments. Nous n'avons pas de questions ou de commentaires pour l'instant. There's no questions for now.
We have one more question in the room. Nous avons une question de plus à la
Minister Mike Couture from Global National. Thanks for taking our questions. I know how you said how this is promising because now it's another one. When you compare the Moderna one to the Pfizer vaccine, this one doesn't seem to need those super cold freezers. Do you think that that makes it a better candidate and easier to roll out in a mass vaccination campaign because of that factor?
Well, listen, I think anything that facilitates easier transportation is obviously a good thing. But I will say this also, the diversity is important because, of course, certain vaccines may prove to be more effective with certain populations than others. As well, I think having options available for provinces and territories is incredibly important. But I think each vaccine is going to have a complexity to it and a certain use that will be ideal. And we'll be working to make sure that we have the measures in place to take advantage of all of the vaccines that eventually become available.
And just as a follow-up, I wanted to ask you, now this is the second vaccine that looks promising, and there, as you had mentioned, there's light at the end of the tunnel. How much are you worried from a public health point of view that people are now going to say in their minds, oh, there's two vaccines that are out there, I can kind of let my guard down, and that the message still doesn't get through to people that the mass vaccination campaign isn't going to start for a while? Or, I mean, is there anything that you can say as the health minister to help people understand that they, A, can't let their guard down, and a better idea of when an actual mass vaccination campaign may be?
Okay. Listen, I think it's critically important over the next few months that we realize that despite the fact that there's light at the end of the tunnel, we have dark months ahead of us. And that if we want to protect the lives of the people that we love, if we want to protect our own wellness, that we can have to continue with the public health measures because A, this is a number of months away. B, we don't yet know with certainty what the effectiveness will be after it's been assessed by Health Canada regulators. So we have a number of steps before we get to a vaccine. It is a light, though, because, you know, at the end of the day, this is going to be a very important tool in ending COVID-19 and having the tools we need to reduce the circulation of COVID-19. But this is a serious illness, and it is a serious illness for all ages. And Canadians need to remember that and act with a high degree of concern for one another. We have to stick together for the next several months and get each other through this difficult time while we await the arrival of a vaccine or other therapeutics that will help us. Thank you. Thank you very much.